Hey everyone, I'm Brittany Skyler, and today is Tuesday, May 27th. You're now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. Reach Out and Read is a national program that partners with pediatric clinicians to support early literacy and healthy parent-child relationships. During well-child visits, doctors give families age-appropriate books and talk with caregivers about the importance of reading aloud. Joining us now is a clinician with Reach Out and Read, Dr. Lauren Jen. Doctor, thank you so much for joining us this morning.
Thank you for having me.
Of course. So I am so excited to talk about this. As I mentioned before, I'm a huge reader, so I can only imagine the importance of starting it so young. So to kick things off, can you tell us a little bit about Reach Out and Read and what exactly do they do?
Thank you. So Reach Out and Read is an absolutely fantastic program that partners with clinicians, pediatric care providers, doctors, nurse practitioners, PAs, to bring culturally responsive and multilingual books into well-child visits or checkups, and also to talk about the importance of reading and building these skills for our youngest children.
And tell me, what does that look like on a New York City scale? And what does that look like for this area in particular?
Reach Out and Read of Greater New York has an amazing footprint. We have 226 sites around New York City, Long Island, and the Hudson Valley area. In the last year, we touched over 225,000 kids with books and distributed over 350,000 books.
That's so amazing. I think reading is something that should be accessible to everybody, but sometimes it isn't. So I think it's a great way to put that, to intertwine that with your child's doctor visits. So in that, tell me exactly how does Reach Out and Read fit into the child's appointment, and what goes on, and what is the step-by-step procedure?
Such a good question. So when kids come in for their checkups or their well-child visits, there's so many different parts of it, and assessing development is part of that. With Reach Out and Read, clinicians are trained to use the book as a tool in assessing development. So we start the visit by giving families a new book, often a book we try our best to be a book in their language. And then we use the book as we assess a child's development. We see how kids interact with it. And then we talk to families about the importance of reading and give them different tips on how to use the book with their kids.
That's amazing, and I think that's a great educational tool, not only for the child, but the parent. But let's go back to these numbers. Over 219,000 children served and almost 346,000 books distributed. How do you make that happen? How does that happen on such a large scale?
Reach Out and Read of Greater New York is very fortunate to have partnerships with some of our publishers, like Scholastic. We have a few of their books here today, as well as state funding and private donations.
Scholastic is such a throwback for me. I feel like every kid remembers that Scholastic book fair and just the excitement and just the air in the morning. It's such a great feeling, and to know that, again, these kids are getting these level of books is amazing. And so let's talk about reading aloud and just the importance it has on children and their development in their early years.
Reading aloud does so many things for our kids in their early years. So, of course, it's so important and foundational for early literacy. It's also essential for speech and language development. But the really special thing about reading aloud is that it does so much more than that. So reading aloud when kids are connected with their parents or caregivers helps to reinforce what we call a safe, stable, and nurturing relationship. If you're sitting with a young child on your lap, holding them as you're reading the book, they can feel you, they can feel the warmth of your voice. They also hear how sometimes we do silly voices when we're reading, we give characters voices. This all cues in babies' brains as they're learning to speak, and it really helps to reinforce a routine. It also does so much for our caregivers as well. Having a new baby can be really overwhelming. And we always say babies don't come with user manuals. So reading helps parents to build a routine and build confidence we talk a lot about book, bath, brushing, bedtime, and all of those things go together to help babies get a routine, get a nighttime routine, and reinforce just the importance of doing this every day.
I love the idea of the relationship building in this, right? I go back to my childhood, and my mom read every book under the sun to me, from like Eric Carle and the nursery rhymes. And even when you get to a certain age, that becomes more educational on things of like, how to protect yourself as a child and those kinds of books. So I think that is so important. And also just thinking about the specific guidelines and the different types of books that we are giving to kids. So with Reach Out and Read, when you do provide these books, are there any particular guidelines that you're looking for? I mean, we have some right here that if you want to talk a little bit about, tell us about that.
Yeah, thank you. We make sure that we give a developmentally appropriate book, which means for our youngest kiddos, they get a lovely board book, so something that they can put in their mouth, which is totally developmentally normal, and we love to see babies grabbing things and putting them in their mouth. Also, chunky board books are easier for those little hands to turn the pages. And then as they get older, we give them paper books. So that's one thing that we think of when we give a book. We also, Reach Out and Read of Greater New York has really made a commitment to books that reflect our families in the greater New York City area. So we try really hard to make sure that the book is in a language that the child or caregiver reads or understands. And we also, as we hear about in education as well, we think of books as mirrors and windows. So a mirror where a child can see themselves reflected in the book, can feel validated in who they are. And then also a window to open their cultural horizons, to open their minds to different things that are out there.
It's so funny. I was just jumping to that question of mirrors and windows. So can you elaborate a little bit more just on how they help shape a child's view of the world and themselves?
Absolutely. We know when kids see themselves in a character, it helps them to build confidence. It helps them to feel seen. So some of the books we have here today are some of my favorites for that. So when a little baby or a family, right? Our little babies aren't able to read the books, but when a family is traveling, say, to Santo Domingo, and they get a book about that really reinforces that this is a positive experience and that they are seen and valued. The same thing when we have books with characters of different races, when we see different types of families reflected in books, it's so important for children.
Absolutely. And I also feel like it's just a reinforcement, again, of that educational component. Like you said, if they're going to go on vacation and they kind of read the book beforehand, of course they're a little young, but it kind of helps, prepare them for what they're going into. And so in that, you also mentioned why you would give certain kids books at their specific ages. So let's talk about how parents can track their child's milestones within the first year, and what do those look like?
So when you go to the pediatrician's office, sometimes you're there because you need your vaccines, but a lot of times what we're doing is assessing development. So we do that in lots of different ways. Sometimes parents get a little questionnaire before they walk in the room, but for us, and the great thing about Reach Out and Read is that it teaches us to use the books and to help you use the books to reinforce with families appropriate child development. So like I said before, we love to see babies putting books in their mouth. That is a totally normal thing. So our 0 to 6 month old babies, we see them kind of looking at you as you're reading. So we know that they're hearing more, they're starting to see more. Our 6 to 12 month old babies are reaching out. They're putting the books in their mouth. They're sometimes throwing the books on the floor. Another reason why we love a sturdy board book. And they kind of are trying, sometimes if there's like a lift the flap, they can try to do that. And then our toddlers are looking at pictures, the things that they see. Oh, I have a dog and I see it in the book. They point to that. They start to make the noises. And they also are really able to interact with the books, the lift the flap, things like that.
Yeah, absolutely. Now, I will say doing some research on this organization was my first time hearing about the organization. Now, granted, I don't have children, but for the viewers at home who might be learning about this for the first time, how do they make sure that they're able to enroll in this program and get these books in their pediatrician's visits?
Definitely visit our website, reachoutandread.org, and you can look for find a site or find a provider, and you can see all of the different sites that are enrolled in this program. Again, in the New York City area, we have 226 sites, so we really have a huge footprint in so many different neighborhoods getting books to kids.
Awesome. And now just tell me, what do you hope for the future of Reach Out and Read, especially as more families face challenges around early childhood development and education?
So, wow, what a question, right? We are really excited to continue building partnerships. Reach Out and Read has a fantastic partnership with public libraries, so trying to connect families into public libraries as well. And we would love to try to reach more and more families, as well as trying to expand our age ranges. Is something that is definitely on the horizon for the program, is something they would love to be able to do.
Absolutely. And now, just before we wrap up, we have a little bit of time. Let's go through these books. I didn't want you to come bring them here for nothing. Tell me a little bit about every book, and maybe what some of the feedback from the kids, if you've heard about any feedback on these books.
Absolutely. So this one is one of my favorites for our little babies. And like I said, for my patients in the Bronx, many of whom have roots in the DR, they absolutely love this book. This is also one of my absolute favorites. It is a collection of family recipes. It's in English and Spanish. And we spend so much time talking about reading and development. And then also, one of the other things pediatricians talk about is healthy eating.
Yeah.
So getting to give families a book that talks about family recipes is so important, because it's really important that families feel connected also to the nutritional discussion. It should be something that is relevant for them. And I will say this one is a personal favorite in my household. Eyes That Kiss in the Corners. My kids have seen themselves reflected in this book and absolutely love it and feel completely validated by it. So thank you.
That's amazing. This is such a family affair. Doctor, thank you again so much for joining us this morning.
Thank you for having me.
To learn more about the mission of this organization, please visit their website at reachoutandreadnyc.org. Don't go away. We'll be back with more Open right after this.